Hello and welcome to Healthcare Matters, the internet television program that explores the intersection of medicine and the law. I'm your host, Mike Matre, and today's guest is Dr. Richard Anderson. Dr. Anderson is the Chairman and Chief Executive Officer of the Doctors Company, the nation's largest physician-owned medical malpractice insurer. Welcome to the program, Dr. Anderson.
Thank you very much. Nice to be here.
Medical malpractice claims frequency is at an all-time low, and the medical malpractice insurance industry has been experiencing its longest soft market in history. Are further tort reforms necessary if claims frequency is at an all-time low and the cost of medical malpractice insurance is stagnant? And if so, why?
Yeah, very interesting. There are a couple of things to say about that. First of all, everything you said is true. In other words, the frequency is down around the country by almost half since 2004. In other words, we have about half the number of claims over the last decade than we did in prior decades. That's great, and there's nothing about that isn't great. It is really good news. But then the question is, okay, it's half, but half of what? Well, it turns out it's half of a crazily big number. So half of a crazily big number is still way too high. To give you an idea of what way too high is, using contemporary frequencies, the average neurosurgeon or other high-risk specialist will still spend about a quarter, 25% of his or her career in court defending an open malpractice claim, a quarter of a career. So the fact that it's down is great, but it is still way, way, way too high.
Okay. As a follow-up to that question, do you see a scenario in the future where claims frequency and medical malpractice insurance rates go up, or have the already instituted tort reforms effectively turned this lower, albeit lower of a crazily big number, and a soft market the new normal?
Yeah, well, that's a great question, and I would say both things are probably true. In other words, I think we have to say that right now this is the new normal, but I do emphasize right now. And what I mean by, I'm using the term as you suggested. There's no reversion to the mean here. In other words, I don't see any reason to believe that there's any force which automatically drives us backwards to the higher levels of frequency that were more common a decade ago. But on the other hand, as I look ahead, there are two competing scenarios. One is that continued application of system integration, patient safety principles, physician risk aversion, better informed patients, more highly evolved surgical technique, more refined medication, so on and so forth, better imaging studies. That it's possible that we'll continue, as we have been over the last decade, to improve medical outcomes, and that the frequency of medical malpractice litigation will continue to come down. Certainly that would be a very, very happy outcome. The alternative hypothesis, though, is not as cheery. The alternative hypothesis says that the consolidation of healthcare that's occurring in American medicine at an absolutely unprecedented rate creates so much dislocation, discoordination, interferes in such a profound way with the doctor-patient relationship that we have to expect that at least for some interim period of time until the new healthcare system is sort of fully emerged, that we would see an increase in litigation because of botched handoffs, ruptured doctor-patient relationships, confusion with inadequate medical records, inadequate electronic medical records, and other kinds of things that all of the change the change in medicine has promise, but it's incredibly disruptive. And it's hard to imagine that in an environment that with this much change and this much disruption, that there won't be the opportunity, unfortunately, for more litigation.
Dr. Anderson, thank you for taking the time to visit with us today.
Well, thank you very much. It was a great pleasure. Thank you.
How has the medical liability landscape and the practice of defensive medicine changed in the last 15 plus years since your article, Billions for Defense, The Pervasive Nature of Defensive Medicine, was published?